construct as you teach. For these reasons, both were negative. I'm now ready for cross-examination.
First affirmative, cross-examining first negative, 2 minutes.
Good afternoon.
Good afternoon.
Okay, so you said that it harms doctors and, you said that some doctors might feel that it's a burden on them. Do you have any numbers of how much that doctors oppose?
Numbers, no, I don't.
So you don't have any percent of doctors. And so then you agree that some other doctor would agree to practice it.
But also they might agree to practice it, but they still might be scarred emotionally and psychologically, though they agree.
Okay, thank you. And also, do you have any numbers or percentage of the current status quo of people taking palliative care?
My partner will detail that in her speech.
Okay, so do you know, because we would want to know before our speech.
Do you want the
Evidence.
Okay.
And then, so then your plan, so for okay, so in the Netherlands, is there a healthcare system?
Yes.
Yes. Okay. Then, and you said that our plan would lead to involuntary euthanasia. Is that correct?
Yes.
Okay. So, but are you aware that our plan is only for granting euthanasia to only terminally ill patients?
Yes. But what I meant is that restrained guidelines doesn't prevent involuntary killing, because doctors, the concept change in the society might be doctors to euthanize the people who are not terminally ill.
Okay. Then do you have any percentage or numbers of people in Taiwan opposing euthanasia?
It's not legalized yet, so you don't know.
That can be a survey. Anyways, I think that's it. So thank you.
Second affirmative, constructive speech, 4 minutes.
Good afternoon, honorable judges, fellow debaters, and I would like to first begin my speech by refuting the arguments made by the first negative speaker. So let's begin. For their defense of the status quo on how we don't need our affirmative plan, they merely claim that the palliative care system in Taiwan is working. However, we have brought up evidence in our first speech citing that only 15% of the patients as of now in Taiwan, of the 47,000, are actually receiving the services by the government of the status quo. So we believe that that is an amount that is not enough, and we would like to implement our plan in order to benefit the people, the terminally ill patients, by first improving the pain management system, pain relief system, and also by legalizing euthanasia, as our first speaker has given the details of our plan. So going on to refute some of the contentions and the disadvantages of our plan that the negative has brought up. First of all, they said that it will harm doctors because euthanasia would make the doctors, their purpose, they will be emotionally scarred. However, as our plan has the clause of informed consent from the patients and also by the families of the patient, we believe that the doctors would feel better if they had conducted euthanasia under such terms. Because in other countries such as the Netherlands, the consent of the family is not required. However, in our plan, it is required. So the doctors in our case would not feel as emotionally scarred as they claim to be, because they also have the support of both the patient and his or her families. So it wouldn't be immoral. And also, they talked about how our plan might also lead to a possibility of non-voluntary euthanasia. We believe that it will not be so because, as we have talked about, our plan has many clauses of psychiatric consent from doctors, consent from family members, doctors themselves, and the patients. So we believe that those clauses and those procedures necessary for euthanasia under our plan would prevent that problem. So that advantage would not be present in our plan. Furthermore, we believe that there is claim of patients wanting to die or having a duty to die if euthanasia is legalized does not stand, because we believe that since the past figures where euthanasia has been legalized, such as Oregon, where patients actually wanted to do that, there was some evidence that does not relate to Taiwan because Oregon does not have a national healthcare system. How come? But Taiwan does. So in that case, the patients would not have a financial burden to die because the national healthcare would actually cover the costs of their treatment and would not burden their families. So that would also not be a disadvantage for our plan. Furthermore, I would like to emphasize the advantages that our plan would bring to to Taiwan. In addition to solving the problems we have mentioned on the status quo of how pain is inadequately relieved and that there is depression, our plan would grants the advantage of improving the lives of the families in addition to the patients. Because there is a study result that they can challenge us for evidence on that shows that the bereaved families of patients who have taken euthanasia actually cope better with grief and stress. So we believe that if euthanasia is implemented and the patients choose it, then it will also be better off for the families emotionally too. And that our plan would also, the second advantage would create positive spillovers in the medical fields. Because if we increase the amount of pain relief drugs that we use, and we also educate the doctors more on the correct use of drugs and treatment procedures, we believe that there will be more knowledge in the medical field concerning that, because as of now, as our first speaker has proven, that the status quo, under the status quo, that type of knowledge is not well sent into the doctors, they're not being well educated. That is why we need our plan to be implemented, so that this advantage could be present, and that if there are spillovers, we might have an advancement in medical technology that benefits all of the population. And third of all, we also have believe that our plan will increase faith in doctors and let more patients go to the clinics, and also create employment opportunities for these doctors and counselors. So with that, I am ready for cross-examination.
First negative, cross-examine. Second affirmative, 2 minutes.
So in the first affirmative speech that you mentioned that you're going to educate local doctors and physicians in order to practice suicide, correct?
No. With on the correct use of pain relief and anti-depression drugs.
And how are you going to educate them?
Oh, we have a working model, which is the American Medical Association's Pain Management Education Program, and I can read you the evidence or you want us to send you the copies.
How you can use them.
Okay. It's here. We have another copy. You can take that one.
So you said that our financial cost burden does not exist because most of the financial cost is paid by health insurance. And do you have a percentage?
No, because it will depend on the palliative care system. That's status quo.
Okay.
So that is part of the status quo.
So do you agree that health insurance doesn't pay all the financial cost of palliative care?
We do not agree because the treatment that the patient receives would be dependent on his or her symptoms. So sometimes there might be costs that may not be covered by the National Healthcare of Taiwan, but we believe that the healthcare system covers more than in places such as Oregon, where the patients do actually not have healthcare services and do not have financial
So you
services.
mentioned that doctors will feel better because they have permission from families and doctors, correct?
No, they won't feel an emotional scar as your evidence reads, because in those situations, it did not have family consent, whereas in our plan, they actually do. They have the support of the family members and the patients
Can you
themselves.
explain that part of your plan?
Okay, so yeah, I can give you the clauses if you want. What is that? Okay, so we would have informed consent from both the patient and his or her family. That's our clause 1. Clause 2, subclause 1. And also informed consent and approval from the doctor concerning the health conditions of the patient and also the mental conditions.
Do you agree that?
Second negative, constructive speech, 4 minutes.
Good afternoon, honorable judges, distinguished debaters, and most esteemed guests. I am the second negative speaker. Before I start with my contentions, I would first like to raise up some questions that are in the affirmative constructive speeches. First of all, they said that 50% of the terminally ill patients receive palliative care. But what is the pool? Do they really need the palliative care? Or is it just because they don't have access to it? And if these patients, the other 85% of the patients, they think they themselves do not need palliative care, then of course they would not want this system. And also, one of the problems with the affirmative plan is about raising taxes. Raising taxes is a very big deal. the legislative branch just passed a bill for a long-term hospice care. And one of the major issues about it is because they want to raise tax. Is raising tax that easy as the affirmative just said, $1 per person? And the affirmative had mentioned a lot of clauses and a lot of details in their plans. However, one question should be thought of. Would all these procedures turn out to be only 2 people are able to apply for euthanasia? Do we have to spend that much time and that much money on a plan that only 2 people can use? And so that those are the questions that the negative wants to ask about the affirmatives. And also the affirmative mentioned about educating doctors about the doses and some medical knowledge. However, the negative doesn't find this any help to their plan. Their plan says they want to legalize euthanasia, but educating doctors, it would not change the status quo since they are already being educated. Now, I would like to point out some harms about some disadvantages that might happen if we implement the affirmative plan. First, as my partner just mentioned, the concept of euthanasia will loosen. Since the affirmative did not define the term euthanasia as active voluntary euthanasia, so there will be more space for discussion. Even if in their plan they said, oh, they will euthanize terminally ill patients, but they did not give precise, they did not provide enough details to determine whether or not they can apply for euthanasia. And so this opens to more space, even more space of discussion. People might be euthanized with